as I indicated, if you're in the first session, the CISA COVID Task Force was designed and implemented by a bunch of cavalry folks. After Director Krebs asked us to come in and serve, we did not know everyone we're going to inherit. Many of them were very different backgrounds. Just by show of hands, how many of the three of you consider yourself to be hackers?
Sorry, did I laugh out loud?
Right. I would say they're all wrong. They are incredible hackers, but the mission is to preserve trust and to save lives. And these three helped ensure we do it. And there's no way we could have saved the lives we did on a daily basis, but for their skills. So we have an infectious disease expert on the end in reverse order, Michelle Holko. We designed a whole new doctrine of ball bearings to find the strategically weak links in the supply chains. But for her medical expertise and Ruben Pasternak and others who couldn't be here, we wouldn't have known who to protect. Lisa Young brought some true risk management and data science and critical infrastructure experience and systems thinking and a voice of reason to help up-level the National Risk Management Center. Kendra, she deserves a Purple Heart for putting up with Josh.
Yes.
She completed me. There came a point where I couldn't even read anymore. We had to write and read real high consequence things together on a Zoom, on a video chat, just to make sure we never stopped the mission. And people got tired at different points. Kendra never got tired. Every single day was right there with us, trying to save lives and succeeding. So Kendra, I don't even know how to describe you, but Kendra made everything come together and ran one of the risk management cells and helped me hack around government bureaucracy to get the right thing done. This is a small slice of the team. There are other govies that helped us, like Don Benak and Tom Millar in the room. Bo joined. Ayan Islam joined. Other hackers that don't like to have their names flaunted joined. Some data scientists joined. But we had a pretty large and growing team. I think we had 100 people at our peak. But I would like you to take a moment, including Spanky, who's somewhere around here from the Aerospace Village. There's Spanky. Spanky, I'm not going to tell you your official title. But I want you, please, celebrate these heroes. Standing ovation, please. Just give them a round of applause for saving lives and keeping you guys safe.
Okay, boy, I guess that made it worth the trip out to Vegas. Thank you, Josh. So what I'm going to do is I'm going to give you kind of a quick what and why of what we'll be talking about, even though Josh did some of that earlier this morning, and then give you an overview of our agenda for today. But basically what we're doing is kind of building on Josh's intro of why the I Am The Cavalry approach, what we were doing in the COVID task force within CISA. Primarily, the main point being that ransomware attacks indirectly contributed to factors that led to excess deaths during COVID, without question. We looked at these cyber attacks on hospital systems that resulted in inaccessible patient records, disrupted communications, delays in processing test results, and we'll go into those kind of details during the presentation. But due to the increased stress on the healthcare industry, hospitals did during the time of the COVID task force and continue to have kind of this increased risk of ransomware attacks. The pandemic's still going on. We act like it was over. We shut down the COVID task force, but this is an issue we're going to continue to deal with. And so CISA, we were able to take the opportunity of the task force, of the agility of kind of this new group that nobody even really knew who we were or where we were, and we could plead ignorance to process, and we just knew we had to get certain things done. And so CISA really had this opportunity to kind of increase industry cyber preparedness and resilience, both related to healthcare, but also to broader private sector work through the COVID task force. So to walk us through all of this, Josh already introduced, it'll be Michelle, Lisa, and I. Michelle is going to talk a lot about the work of Operation Warp Speed, the ball bearings worked, how we helped to identify who were the critical people, because we couldn't get to everybody, but where along the supply chain did we need to focus our efforts. Lisa's going to talk about the healthcare portion and really the journey of the provide medical care work we did, which resulted in publishing our statistics and our analysis about the impact on the healthcare sector and the impact on excess deaths. And then I'm going to end up with a very high level. I'm not a cyber person. I didn't raise my hand as a hacker. But I'm going to talk about the cyber tools and the work we did, which we took the opportunity of the task force to develop, and then we're able to transition into steady state CISA. We were able to give those tools to our cybersecurity division to continue to work on sharing those, not just again with healthcare, but with broader critical infrastructure, water, energy, everybody out there. And I am one of the few people from the COVID task force who decided that the mission felt like something I should stay and do. So I'm actually now a permanent Govy, and with CISA and able to continue, I hope, the work of the COVID task force and what we did in the cyber area. So first, just in case you haven't heard me repeat it several times, a little bit about CISA, and it is pronounced CISA. It's still, we're really the newest agency in the federal space. We just celebrated 3 years, and we are the nation's risk reducer. We look to lead the national effort to understand, manage, and reduce risk to both cyber and physical infrastructure. What I think is really important to the COVID effort is that CISA does a lot of work at the federal level and working with the states, local, tribal, and territorial government and municipalities. I think the COVID work was a really great example of the private-public partnership and how we can work with the private sector more closely in a more decentralized fashion, working with smaller companies, particularly working with small and medium-sized enterprises. So, like I said, today's agenda, we'll start with Michelle kind of talking about the CISA COVID task force, what we did initially, the initial work that set the stage for everything we're doing, move into healthcare at risk, and then tackle a little bit about the cyber threats. So, with that, we'll turn to Michelle.
Awesome. Okay, can you guys hear me? Fine? Okay, awesome. So, it's nice to be here. It's great to meet all of these people in person for the first time after working together for over 2 years. It's really incredible. And I am absolutely not a hacker, although I can play one on TV. I'm a scientist by training. I have a PhD in genetics, and I've worked a lot in the bioinformatics space, both for cancer biology as well as infectious diseases. And actually, the majority of my career, I've been in the public sector. So after my postdoctoral fellowship, I was a staff scientist at NIH, helping them with their databases and promoting reuse and reanalysis of data that have been publicly funded. So again, getting the most out of the data. And then I was in the private sector as a contractor, but contracted back to the government and worked at DARPA in the Biological Technologies Office. So the office was 1 year old at that time. And one of the major thrusts was the Prevent the Next Pandemic portfolio. And I was the technical lead for a lot of the programs under that umbrella. We were funding Moderna at the time. We were looking at wearables and signals from wearables and how those could be useful for pre-symptomatic detection of infection. And so there was a lot of, like biosecurity, biosafety angle to it, but it was all about, pandemic prevention and getting left of boom. So if you look at the epidemic curve, whenever there's an epidemic going on, you get a really strong growth curve, and that starts really early on. So the farther you can get left of that really strong exponential growth curve, the better you're going to be. And the
Louder.
Okay. So the better off we're going to be in terms of saving lives and preventing death and epidemic spread. So all of that to say, then I went back into the government as a White House Presidential Innovation Fellow and was working with the NIH All of Us research program when COVID hit. So I was working with that program from October of 2019. And then COVID hit, and because I had been working in the pandemic space really strongly at DARPA, and also coupled with the fact that there were very few scientists in government at that moment. You might be surprised to hear. OSTP was kind of a graveyard, and lots of empty offices there. So there were very few, federal officials that really had the expertise that was necessary to push things forward. And so because of that, I started to talk to others in other agencies and figure out like how I could help. And one of the connections was made to then head of the NRMC, the National Risk Management Center at CISA, Steve Curran. And he and I had a conversation about, the need to really have that kind of expertise when we think about the risks associated with the pandemic. And so because of that, only because of that, like random connection, and it was actually through one of my kids' best friends in kindergarten's parent is Steve Curran's brother-in-law or sister-in-law, which is like totally random. But I was just complaining to her one day that I felt like, the work that I was doing wasn't really very integrated with the pandemic, made that connection. And so Steve brought me on board. And it was literally, the first few days of that was challenging because this is awesome. Are you bringing snacks?
So if anybody's not familiar, we have a tradition here where speakers are allowed to make an outrageous speaker request for basically anything. And then I get to be an evil genie if I want to and fulfilling it. But this time I'm just playing it straight. So you've all been authorized to come grab some of these. I'll just pass them around, whatever. Dove promises in various different flavors.
We should open up and throw them.
That's awesome.
Put Josh in charge of that.
That's awesome. Fantastic.
Oh, that is too funny. Thank you so
Fantastic.
much.
So if you don't know,
Thank you so much.
it's,
We deeply appreciate you being here and the work that you do.
well, thank you.
Thank you.
If you don't know, the reason I made the request is, one, chocolate, really. But Dove Promises, if you don't know this, inside the wrapper, there's a little nice saying that tells you something positive about yourself, which we should have had them every day during the COVID task force. But it's just a nice way to remember, you're here with the I Am The Cavalry session. And so when you eat your Dove chocolate, and even if you don't like chocolate, make sure you check the wrapper and just give you a nice little reminder about how special each and every one of us is.
Yes.
Awesome. This is fantastic. I wanted to start by just kind of telling you the story about how this whole CISA COVID task force kind of came to be. And it wasn't anything that was intentional initially. And it really started, I think, on the first meeting that Josh Corman joined. I had been there for about a month, and we were in this space of trying to figure out what to do with all of these lists of companies and entities that the federal government and our international federal partners thought were important to protect during the pandemic. And so this very first meeting was kind of a mess. We were literally just talking about this list and all of these companies on the list and how were we going to prioritize. This list was over 1,000 companies big, right? And so CISA did not have the ability to provide cybersecurity services to all of them at the same time. It was a very kind of limited team. And so we needed to figure out, like, who were we going to protect and how were we going to do that? And so we were talking about what does the list look like? Where did the list come from? There were a lot of different contributors to the list. And then we started talking about, like, well, what's on the list? And Josh, day one, was like, I think we need to think about this from the perspective of ball bearings in World War II. And if you want a bigger description of that from Josh later, find him and buy him a drink and he'll tell you the long-winded version of that. But the concept is, like, instead of just taking this list at faith and trying to work our way through it, we needed to figure out how to prioritize the entities and get to the ones that were the most critical and had the most potential impact first. And so that's how that all started. And it literally started on Josh's day one in the government. And he was very open with sharing the fact that Chris Krebs had asked him to come in and to do this.
Please excuse me.
Yes.
Slide the microphones slightly closer to you. We
Okay.
also have to have you speak up just a little bit. So
Okay.
sorry for the inconvenience.
No worries.
With the air handlers, it would just be helpful
Yeah, no worries. Yep, absolutely. So anyway, so all of that to say, there was no method that we started with. It wasn't like someone said, "Oh, here's the method to use," to our data scientists to prioritize the list. And so we had to come up with something. And I think one of the things that I learned throughout this process is something is better than nothing. We had nothing, and we had to get to something. And it really did. It required this interdisciplinary approach to it. So we had, Josh kind of at the strategic thinking level. I was kind of the biotech subject matter expert. We had Reuven Pasternak, who's an MD by training and emergency physician, and his level of expertise. And then one of the things that we also started to come to, the task force really came a little bit after we had kind of gotten to a baseline of what this was going to look like. Then we started to realize that we also needed to think about things in a less narrow focus, right? And so we had this slide that we're not showing you today, but basically to kind of capture where these entities were coming from in terms of priorities. So there were Operation Warp Speed entities. So all of the companies that were directly funded. You can leave it on the previous slide for now.
Okay.
So there were all of the Operation Warp Speed entities, which basically any organization who got federal funding to participate in Operation Warp Speed, they were developing vaccines, therapeutics, and diagnostics. So all of those entities and any of their partners were all on those lists. There were also kind of adjacencies to those types of products. So whenever you're doing research around vaccine development, you need a lot of different materials to, do the cell culture and testing. So things like mouse embryonic fibroblasts and, bovine growth hormone or lots of different, biomedical tools that might not be directly funded, but that are going to be really critical to being able to do that work. So there was like the Operation Warp Speed, there was the Warp Speed adjacent type stuff, and then we started thinking about the healthcare delivery in general. So once we got to the point where we had vaccines to deliver, were we going to have enough syringes? Were we going to have enough gloves? We had a huge issue with PPE early on, and people not having access to PPE. There was also an issue with sourcing latex globally. And so there were all of these various types of motions that we were also trying to account for and really expand that from that very narrow view. So the CISA COVID task force really grew out of that kind of initial prioritization effort where we were just kind of, to be blunt, we were just making stuff up on the fly. What we ended up coming to, and again, not to go into too tremendous detail, was we did an assessment of all of the companies on the list according to 4 different criteria. So one was, what is the product? Is it a vaccine, therapeutic, or a diagnostic? But also more granularly, is it an mRNA-based vaccine? Is it an immunotherapy-based therapeutic, et cetera? Is it a diagnostic that can be done in the home, or does it require, lab-based testing? Another of them, the criteria was, how scarce is this? Is there only one company able to make this, or are there other companies that can also make this thing? Do we have a high supply of it or a low supply of it? So things like that. We also considered the dependency rating of the companies. So a good example around dependency is for all of the nucleic acid-based vaccines, they all require this same kind of really specific phospholipid to encapsulate them so that they can be absorbed and integrated into your biology. And so those phospholipids, we learned that there was actually very few sources for those phospholipids, and yet all of these products were going to need them. So that was kind of where the dependency came in. And then there was also a material impact potential rating that was very subjective. It was basically me and Reuven going through the list and thinking about, if we had this, how impactful would that be for our ability to respond to the pandemic? So we went through this list and did all of these ratings, and then kind of racked and stacked and, developed a metric that prioritized the list, and then we took that prioritized list and we broke it up into 3 chunks. The top tier were the most important to protect. The middle tier, we'll get to them when we have time, and then the last tier, we're not going to worry about them so much. And that in that way, we were able to really prioritize cybersecurity service delivery for those most critical entities. And we had a couple really interesting things that came out of that initial prioritization that gave us confidence that it was actually doing something useful. And I think that was really the nucleus of what justified to leadership, that we really did need this CISA COVID task force that was going to not only implement this initial prioritization, but as new things arose, as, shortages in PPE, as, hacks on, healthcare delivery organizations, as all of that continued to happen, that we were able to continue to respond in a timely manner. So, a key thing to note here is that, we are from diverse backgrounds. I am not a hacker, although I've gotten a lot more into cybersecurity and the security aspects of biotech in particular since doing this work. And I think that it really does take all of those various perspectives, thinking about things from a systems perspective, thinking about things from a biology perspective in this case, I think is really critical. So yeah, next slide. So one of the other fun things was, in addition to people like myself who kind of detailed in, and Reuven who detailed in, and Josh who detailed in, we also were kind of creating a coalition of the willing in a way, right? And so people were excited to contribute to this effort, and creating that energy and really figuring out who was going to be helpful and willing to help. And almost, everybody was amazing. Everybody that we worked with was amazing. And one of the things that we did kind of early on was we went around and talked about who was your superhero that you identified with. And that was something that I think was really important. And mine is Elastigirl. I also teach yoga, is one of the things that I do. And I always say we bend so we don't break. And I think that's a critical message around resilience is, figuring out how we can adapt and continue to pivot whenever new things were arising, as they were daily during this time. So next, I think I already voice tracked this, but really we had, some CARES Act hires. There was a hiring authority that was able to bring people in really quickly. So Reuven was able to come on board really quickly. In other cases, like in Lisa's case, it wasn't so quick. But in some cases, it was really very quick. People were able to come on board in kind of a flexible manner, which is not usual for the federal government. You may be surprised to know. It usually takes a really long time. And there's a limit in terms of the number of billets. And so one of the things that I'd like to suggest as, the Cavalry considers how it works in the future going forward, CISA as the youngest government agency really is in an opportunity moment, I think, where it is influenceable more so than it will be in the next 10 years. And, I think, Josh, having people come in this kind of a flexible, fellowship kind of a way from the Cavalry into CISA, I think would be one really exciting way to do that. So the fellowship that I did that brought me to CISA is this Presidential Innovation Fellowship that kind of does the same thing. You're term limited. For 1 year, you can extend to a second year. But the point is to bring people from tech companies that are going to bring in the latest and greatest from tech directly into the government in kind of a leadership role. And I think that would be a great model to follow with the Cavalry going forward as one of the ways that you can continue to influence the way that things are going, especially in the government thing. And then, we certainly had, career CISA employees that joined the task force. So let's go to the next slide. So Operation Warp Speed, I gave a little bit of an introduction of that. And so basically, Operation Warp Speed was a whole of government effort to develop the vaccines, therapeutics, and diagnostics we needed for COVID-19. There was a lot of early focus on the vaccine, especially if you understand infectious diseases and epidemic spread. The sooner you have a vaccine, the sooner you can really prevent things. And we're seeing a really interesting path with COVID where, yes, the vaccine is helpful, but we also need the other things too. And so it's good that we were funding those initially. But at the same time, we had an awareness that it's not just about those specific products. There's a lot of adjacencies here that go into protecting the critical infrastructure that is, provide healthcare and what is the term for it? Provide medical care. Provide medical care. Anyway, all of that to say, I think that Operation Warp Speed was a way for us to not only hone in on what we were focusing on, but also, thinking about protecting that broader mission, because the rest of Operation Warp Speed wasn't focused on that, right? So one of the challenges we saw was that who's going to be a little bit more forward thinking, who's going to think more broadly about, how we really do this in a way that's meaningful and saves lives. So that was another thing that we took on. We were very integrated with all of the Operation Warp Speed stuff. We talked to DoD all the time. We talked to HHS all the time. And we also got really close with on the Government Coordinating Council with the HISAC. There wasn't a BioISAC at the time. They just launched, I believe, last year. But a lot of that grew out of the need that we saw and some of the vulnerabilities we saw in biotech during this time. But the Health ISAC, I think, we learned a lot from the Health ISAC, and I think that's another way that these public-private partnerships are really critical, is even just in information sharing and awareness of the state. There was a very chilling, I don't remember the number, but there was a very chilling number, I think it was something like 80% of healthcare delivery organizations or something were operating with outdated software. Do you remember what I forget the number, but anyway, it's chilling when you think about that. Like, do you really want, my youngest son was in the NICU for 3 months, and I think about like the software that was running all of his equipment and keeping him alive every day. Like, do you really want those hackable? Or be really vulnerable to security threats? So anyway, that's just personally something that I think a lot about. Yeah, next slide. Okay, so the goal of the kind of ball bearing strategy was really to, again, a prioritization effort so that we could focus our delivery of services to the weakest links. So finding the weakest links, finding the key targets for attack, and being able to action on them. Okay, I think I voice tracked this mostly, but yeah, so we really, again, we focused on this kind of the Operation Warp Speed as kind of the way that we centered where we were looking, but again, we thought more broadly about it too. And then the output of that effort was to figure out, who was our tier one? How are we going to get this list of thousands down to a manageable number, and then work with our regional teams to actually be able to provide that support and cybersecurity service delivery to these organizations, and even just assess, what their cybersecurity status was. Early on, one of the entities that we identified, we reached out to them, and we learned that they didn't have any security people on staff at all. They had 2 IT people, and they were both like, oh, okay, wow, this is interesting. The government wants to talk to us about our security, but we don't actually do that. And one of the strategies that they used was to keep their manufacturing offline, which is a fine strategy in some cases, and certainly for parts of their system. But this company was quickly then acquired by a larger organization, which made our outreach a lot more complicated, because then we had to talk with our international partners about talking with them, because it was an international company whose cybersecurity was in a different country than the company's headquarters. So now there are 3 countries' governments having to coordinate on, how do we talk to this organization? How do we give them the security services they need, so that we're going to protect this, because this was one of the ball bearings. So, I think that's a really good example of how, all of this coordination, not only like our team, but also the coordination across governments was really critical to this mission. And then we also, thought more broadly about healthcare delivery organizations, and Lisa's going to talk to you more about that.
Right. Okay. So this is complicated, all of this stuff up here. So hang on a second, because I want to make sure I don't forget anything. How about that?
We'll have a
better. Yay. Okay. All right. So Michelle said a lot of things, and the title of this is Cybersecurity Lessons Learned. So I'm gonna translate a few things. So remember that the ball bearing strategy was fantastically applied because risk is always about uncertainty, and it's about focus on the critical few, right? So in all of your organizations, you should be focused on the critical few things that matter to your mission. Now, your mission could be government, industry, for-profit, nonprofit. It makes no difference. The point is, all the assets that you're trying to protect need to be in service of the mission, right? And so the other thing that she talked about a lot, translates into supply chain, right? So I'm a risk person, yes, I have a cyber background. Yes, I'm going to make a shameless plug here for anybody who's interested in getting groomed to serve on the ISC2 board of directors. So I am an ISC squared member long term, and I know that some of you are disgruntled. But the point is, we're doing fantastic things. We're doing fantastic things there, and we need more diversity and inclusion on the board. So just FYI. Okay, so long story is that, supply chain, when Josh called me and said, we're putting a band together to do some protection of the supply chain of the vaccine, I was like, okay, I'm in. He didn't tell me what we were going to be doing. And actually in the end, so my avatar, I'm a big Avatar the Airbender, so I'm Katara. But the point is that my I didn't have an avatar when I first started, and I was the last one to join the team. And so somebody, I don't know if Ed's here, but he gave me the one called Semper Gumby. And the reason he gave me Semper Gumby is because I'm always about, okay, how are we going to meet people where they are, and how are we going to bring them along, right? And we had to meet people, as Michelle indicated and Kendra indicated, at various levels of understanding, various levels of, we're from the government, we're here to help, and just imagine getting a call like that, right? And plus we had a mission, right? The Operation Warp Speed was run by the military, but the vaccine and the other, other things were run by people like us. So I'm going to talk, Josh gave you a lot of statistical information, but I'm going to try to make this next section about what we learned. So my background is in risk, but it's also in, so I spent 3 years working in automotive safety and helping improve the security from a coding perspective, right? And then I also worked in the energy. I was working in energy, municipal power specifically, but also National Rural Electric Cooperative Association. When I say two guys in a generator, sometimes it's only one guy in a generator in the middle of Oklahoma. And so I was working in for the energy sector, and of course, water was a part of that. How do we protect those things? And I had a public-private partnership background. How do we actually get people to fund, people who can actually do things in the field? So I'm really excited. I have another talk this afternoon. David, are you here? Yes. about the dumpster fire that is critical infrastructure and how we're trying to help. But, okay, so next slide, sorry. Okay, so Josh spoke about this, but I want to be very specific. So think back to the spring of 2021. I know we all have a little bit of, trauma around this time, but the vaccines had recently begun, sorry, I can't see. The vaccines had recently begun to roll out, right? And the pandemic was continuing to exacerbate existing strains on the national critical function of provide medical care. Hospitals were flooded with patients that needed acute care. Materials and PPE were in short supply, and there were low vaccination rates. And remember, DHS's mission also had a mis, dis, and malinformation campaign that they were running that from the previous year on the election. And there was a ton of, social media targeted mis, dis, and malinformation about vaccines, which created vaccine hesitancy. So we were combating those threats at the same time. And so the team undertook some amazing research, which is on this slide, and there's even more, the papers that Josh showed earlier, with the purpose to understand not just the functional impact at the ground truth level about what was going on in hospitals and hospital operations, but the cascading impacts on other critical infrastructure sectors. So as I said, I was in the energy sector, and the American Public Power Association was my customer, long-term customer. If you're familiar with the cybersecurity scorecard that APPA rolled out, I was a big part of that effort. There was a big team, not just me, but the point is we were trying to raise the bar on cybersecurity in the smaller municipals and rural co-ops. And so what were the cascading impacts from this, electric, food, water, logistics, to losing critical infrastructure workers, right? Because at that time, we also were very much in need of personnel. And when APPA, before vaccines, right in the very beginning, we were having daily and weekly calls about sequestering. We sequestered all of our line operators and all of the maintenance people. And some of you in this room may have been sequestered in some of the hotels that weren't being used anymore because people weren't traveling. So we were putting people in, very strategic locations so that if something happened to various parts of critical infrastructure, we would have people who were healthy who would be able to service that. So that was pretty important. So unlike COVID deaths overall, which generally struck those aged 75 years or older, the excess deaths were highest in the 25 to 44-year-old ranks. And when you think about those are the people who are serving up our critical infrastructure by and large. And, factors included avoiding medical care because for other conditions, right? Like such as high blood pressure, diabetes, or other things that were going on, postponing elective surgeries for too long, and also loss of health care because they lost their job or they lost their benefits or, loss of income. But the racial and ethnic subgroups experienced a disproportionately higher percentage increases in death during this time, right? With the most pronounced effects on Hispanic and Black communities. And so that's also in our research. So you'll see that in there. And that we think was, a terrible thing. But this trend continued until, in September 2021, there's a state of emergency that you can declare as a healthcare provider called critical, I wanted to make sure I got it right, crisis standards of care, right? It's known as CSC. And by September of 2021, there were 4 or 5 U.S.-based, and we were in coordination with our international partners, but I can only speak about the U.S. The point is, by December of 2021, there were 9 out of 50 states operating at crisis standards of care. So this was quite, the trend was also happening across the globe. So I'll go to the next one. And the perfect storm, what created the perfect storm is also the bad actors, were opportunistic in looking to do bad things. And with the healthcare organizations already suffering, it became harder to prioritize the cybersecurity practices that needed attention. Hence the work we did on bad practices, hence the work we did to make sure that we were vocal about absolutely everybody knows that certain things are just terrible, right? And so don't do them. But it was hard to get the word out because of the noise, right? And I think, I don't know, Josh and I did, and many of us did many tabletop exercises with organizations. And what we found out, we learned through the Health ISAC, is that the majority of their members were not cyber poor. They were actually in the upper echelons, and they had the time and energy to devote to belonging to ISACs. So how did we get the information out to those who needed it most, right? And so many of the hospitals, the other thing we learned is that they did not, many of them have an incident response plan of any kind, generally speaking. So they hadn't really thought. I mean, the fact that they weren't all patched and all the other things that, Michelle talked about, they didn't also have the basic resources. And one of the things that, as public-private partners, one of the solutions I'm most proud of is when we did the work on the cybersecurity scorecard the first year, we went around and basically put together an incident response plan for municipal power companies and gave it to them. Now, it was funded by DOE, which then got funded to APPA. But the point is that money has to trickle down to get to people who need the things and tools, right? Okay, so the other thing about incident response plans is even the ones that had something on paper, they hadn't tested it under some of the conditions under which they were operating. So go to the next one. Now, Josh mentioned the ransomware event, and it was terrible, but it gave us the ability to actually look at what happens to someone when they have a ransomware event and talk about it, right? And so in this thing, you'll see a timeline, and we published a good bit of research, but what actually happens when someone is suffering from a ransomware attack. Go ahead and go to the next one, because these are some of the knock-on effects that happen, right? And even just what Josh mentioned earlier, not having electronic health records available and having to revert to pen and paper. Well, then how do you get pen and paper records on someone to the next medical professional down the line who actually needs that information, right? And so go to the next slide, because one of the other boards I serve on is CIRA, and for the Society of Information Risk Analysts, which is a quantitative risk group of non-hackers. But the point here is that Josh, Jeff, who couldn't be with us today, who's part of the team, and Dr. Katie Webster were, instrumental in asking the questions, asking the tough questions, and then performing the research. So this talk is actually recorded. It was done in September of 2021, I think. But that was when we first, I think at this point, some of the research that Josh spoke about hadn't been published, right? It hadn't been published until later. We were having trouble getting the word out, right? Doing great work, but having trouble getting the word out. So I'm going to turn it back to Kendra, and we'll finish up here. Go ahead.
Okay, just real quick, we're going to go through, I guess, first of all, I should say my superhero was Wonder Woman, and I feel like I spent most of my time just spinning around trying to get that magic going. And so, as Josh said, my contribution to the team was herding the
She was
cats,
the glue.
managing it. The glue, there you go. So what I want to talk about now, and I'm going to talk about it at a very high level, because later this afternoon, Tom and Don, who are over here with us from CISA, are going to actually go into the details of some of the work we've developed in the cyber area. But basically what happened is I'll get it. Oh, no, I'll just sit closer. So there we go. As the task force kind of moved from Operation Warp Speed away from the vaccines, our focus really was on the healthcare delivery organizations, small to medium-sized businesses, kind of key to the whole infrastructure of healthcare in the country. And so we took a lot of the work that we had been doing, and we're promoting free cyber services, and we specifically went after the HDOs and went out to the healthcare delivery organizations and said, do you know we do this? We had a lot of practice or prep with those documents the year before during the election. We had updated a lot of our documents to go to local election boards and help them with how do you make sure your systems at your local level are secure. And so here's just a list of some of the programs we have. And again, we had some that we started with, but then, for example, stuff off search, getting shit off Shodan, stuff off search, also looking at census, Thingfold, any of the things that are visible, where your devices have visibility on web-based search platforms was something that we felt was important to everybody, but we had a mechanism to say, let's develop some products to help the HDOs, to help those small businesses, those small entities understand what this specific risk is. And this was just kind of the first of the examples of products we developed within the task force and then said, oh, wait, we have this cybersecurity division at CISA that's here all the time doing this, over and over and over again. And so we're able to pass those off. So they're now, living documents at CISA and not just focused on the healthcare delivery section. We also talk again about that whole broad definition of our intended audience is the target-rich cyber poor. And so again, support for the healthcare delivery organizations and trying to take both what we already had and then the new things we were developing. I think several people have mentioned the bad practices. I think that's when Tom was already a part of our CISA COVID task force as a career employee. We then had to pull in Don Benak because he really liked what we were doing. We liked what he was doing as the head of our vulnerability management group at the time. And so these are the sorts of things where, again, really basic help to small entities like the organization that Michelle mentioned earlier, who didn't even have cyber staff, and yet they were producing part of the critical vaccines that we needed to get out in the country. And so trying to help people with understanding, what our strong password practice is. How do you, make sure you're installing patches, that you're keeping your software up to date, getting your stuff off search. it really became a way for us to quickly develop and pass on information that was specific to the COVID community, but would have broader implications for critical infrastructure, which is, CISA's job. So basically, our premise was that what we were implementing for the community we were focused on during the COVID task force, the focus on vaccine and overall patient care priorities, also allowed us to start building for the future of what the agency could be doing. So when we look at kind of lessons learned, I would say the first one, we kind of looked at this smaller, more nimble organization within CISA that was allowed to give us that ability to do more cross-agency coordination. Frankly, I think I know more people across CISA than my colleagues, now that I work there full-time, than my colleagues within my group know across the agency. I was able to work with different branches, different divisions, and we were able to take that work much broader. Always opportunities for improvement, but here are kind of our list of the basic good, the bad, and the ugly. Having that CARES Act staff, having people come in from the outside with different perspectives, different mentalities. Crisis is a perfect time for piloting efforts. Like we did get pushback, but we didn't always get pushback, and we were able to achieve a lot in a very short period of time. It gave us a lot of ability to reach out across the healthcare community, international sharing. Bo especially did a lot of work overseas with our counterparts. I think with only 5 minutes left, we're probably not going to talk about, there's always work left to be done, and we have work left to be done within the agency and outside. Again, how CISA can help. These are the kind of things I think we'll talk about some more this afternoon. But yeah, do you guys want to kind of add to any of these closing ones?
Yes. Can I say one more thing? So we actually, I'm really proud of this because we won what's called a Unity of Effort Award. Okay, it's a really nice statue that they sent us, but it wasn't that. The reason that I'm really proud of it is because of what both my colleagues said and everyone here has said, is that we made people talk to each other who didn't want to talk to each other. So we were all the people in different silos, and that for me was like a proud moment. So even if I hold up that award, it sits behind me on my bookshelf, like when we picked up the phone and called the people we knew and called the people they knew and called the people somebody else knew. And so when, we talk about a hacker community, I mean, that's one of the ways we hacked the government, is just to call people and talk. Did Josh want to say something?
Just that since there's a break after this, we could take a couple of questions, even though we're running out of time.
Just to tag on to that, one of the ways in which we did that was shocking to me and actually took a really long time was the way that we talked to the FBI so regularly.
Yeah.
Because, with the field offices, there was a lack of coordination at the local level between Intel and, CISA. And I think it was partially just because there was trust building that needed to happen there. CISA was new to this game. We were brand new, and we were leveraging our DHS field offices. And so doing that coordination with FBI, it also took a lot. And I think that was one of the biggest pieces of progress that was made.
Agreed. Yeah, and we did a tabletop with the FEMA folks, which was super awesome because there was like 90 FEMA, and a lot of them are lawyers, and they were like really scheming on how they could like put in some emergency authorizations to help people, right? And it was a bright spot for me because they were just so willing to say, yeah, throw down, let's spend some money on helping people over here, and and we can do this and we can do that. And so I was jazzed by a lot of that, despite the PTSD of, working across government.
Uh-oh, we got a stop sign.
So we have about 5 minutes left.
Can we do that? Okay, great.
Try to use the mic so people on streaming can hear you. Yep.
Well, can you all hear me? Okay.
Yeah.
First, thank you for what you all did to help through a difficult, critical time. Really appreciate you all for that. you had this opportunity to stand up a team for a purpose. And I'm just curious to see, is the CTF still in place? Did it dissolve? And how does that work continue? If you pull together for something like that, how do you make sure that the initiatives that you started continue after that initiative is no longer there?
Great question. So the task force was formally disbanded at the beginning of this year. We had, during the whole course of it, we always had a strategy that some of us were discussing, which is we're going to spread out across the agency. When we leave the task force, if we embed ourselves in different divisions and different groups, we will keep the dialogue going. So a couple of us stayed, a few of us. I think there are at least 3 CARES Act who converted. There were some existing people, Bo's still with us. So those of us left have tried to intentionally, we know something the rest of the agency doesn't know. There's a ton I don't know about how the agency works, but what I do know is how I can reach across to different groups. And I think we've tried to leave that. We've also, again, how many of us from the task force are here in the room today? Yeah. Oops, like half of the task force is here. And so I think we developed a passion for this mission that turned out to be I Am the Cavalry, or nexus to, that's going to keep us kind of together in trying to both work, extending the work of the COVID task force, but also the work of government. How do we make government more official, more efficient, more relatable at a local level?
And Kendra, you shared last night that, because I've since moved on, but you shared last night that there's now someone who's come to CISA to lead up like medical, which is not a domain that CISA had coverage on from a subject matter expertise perspective, which was kind of why I was brought in initially. But, so building that a realization that is an important expertise to have when you're trying to protect the nation's critical infrastructure is good.
While they're heading up, one of the reasons I said we're still needed is there's a strong desire, based on Chris Hoff's keynote of Conway's Law, there's a strong desire for agencies to stay out of each other's way. But what we realized early is these multidisciplinary intersectional risks require multidisciplinary intersectional solutions. So there's almost like a battle for the soul of government of, are we going to be siloed by agency, or are we going to be cross-cutting? And they're keeping the flame alive for the forced, uncomfortable interagency collaboration, even though it's the easier thing to do to stay in your silos. But silos kill. So,
go ahead. Can you guys all hear me? Oh,
yes.
Wow. Thanks. Hey, so first of all, thank you. I actually work for an organization that supports the Defense Health Agency, so you guys were integral to, yay, team awesome. So thank you very much for that. So my question is in my opinion, a lot of our C-suite guys were like, who's going to hack a hospital? Like, what bad guy out there? Meanwhile, everybody who's in it is screaming, like literally everybody. But I feel like the problem that I'm having now is a lot of people are losing the cybersecurity message in the pandemic. They're like, oh, they only went after us because things were so stressful. Hospitals are still safe. Are you seeing that shift? Are people starting to get it? Or really? That makes, okay, I'll take it. I will take the tiny little bits.
Wait, Michelle said something is better than nothing, right? Okay, so the answer is yes. We are. I think there's a lot of passion around getting that message out. So yes, I think so. I hope so.
That was awesome, by the way. Thank you so much for everything you've done. I spend a lot of time in the small, medium biotech space in community hospitals and places like that, and I would love to hear just a little bit more of your stories about how when you called those guys up, who have an IT staff of 2 and no security people, how did you actually get them to do anything? And what was? Tell us more about those stories.
Yeah,
that might have to require a drink.
I think so. I think we're going to have to cover that one. And there were so many really good ones. And I think Bo would actually probably have some things to share about that, and Josh too. But
that because sometimes they thought they were getting punked. Like, you're really from the government and you're calling to offer me free cybersecurity services.
Well, and also, oftentimes in those initial calls, we had to include all of our government interagency people. So we would have someone from FBI on the call. We had someone from HHS on the call. We had CISA, and people literally thought it was a joke initially. Yes. It took a while for people to kind of trust us.
Hi, question for Lisa. Did you have any application for quantitative risk methods?
Thank you, Russell.
If so, what did you learn? What were the benefits? What would you advise other people?
So the answer is yes. And to your question about does the C-suite actually pay attention to things? Russell is my partner in crime for CIRA. And, we're striving hard to stop talking about records and actually talk about impact to the business in what matters to them, right? And records may matter if you have a data breach, but the point is those costs are well known and those are easily measurable. The difficulty is in the things that we don't yet have full information for, and Russell has done some fantastic work in impact, categorization, cost. And the reason I said it's important for you to focus on your mission is because the mission drives what you care about. Right? And so whatever your mission is, it makes no difference. And one thing I didn't say when I started this is these are all my opinions. I am not here representing any employer or DHS anymore or anybody that I've worked for ever. So the point is that quantification gives you the ability to talk to business leaders in their terms. I'll just give you a very simple example. When you say server X is down because blah, blah, malware, blah, 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 nobody really cares. But if you say server X is down and it impacts our ability to accept customer payments, all of a sudden people pay attention. All of a sudden when you can put it in terms that matter to the business, people really do listen, right? So to the degree that we can do that, the better we can do it, the better it informs our ability to talk to leaderships and people making decisions on the things that we're tasked with protecting.
All right, I think we are out of time.
Okay.
Thank you
It's
everyone
time for
for
food.
coming.